Hear from our occupational therapist. Let's listen to find out how you can become an occupational therapist and make a difference.
My name is Abraham Aguilar. I'm an occupational therapist at DHR Health. I'd like to take the time to thank Past Project for allowing me the opportunity to speak about occupational therapy. So a quick overview of what will be discussed today. I'll define what occupational therapy is. I'll describe a typical day at Therapy Institute, which is the clinic where I work. And I'll talk a little bit about the future of occupational therapy, some exciting stuff there. So at DHR Health Therapy Institute, there are 3 occupational therapists. I joined the team last year of 2019, but I've been with DHR since 2011. During that time, I've worked at the main hospital and the rehab center. I completed my master's in 2010, and I will begin my doctorates this year in the fall in 2020. I'm certified in a couple of certifications that deal with neurological conditions. So my main areas of focus in therapy are people who've had brain injuries, strokes, spinal cord injuries, or other neurological diagnoses. But I also see patients who've had other diagnoses like amputations or recent surgeries. Fun fact about myself is over the past few years, I've gone into doing Spartan races with my son. So it's an outdoor running event with obstacle courses, and we obviously have to work out and train for it. But if we're going to promote health, we should also try to live that example. So one of the things that I like to do is bring some of those workouts into the therapy session. There's plenty of young patients that enjoy working out, but because of their illness or injury, they have a hard time. So there's ways of modifying the activity or using special equipment that allows them to do some of these CrossFit or gym workouts that you normally see. So what is occupational therapy? Occupational therapy is a healthcare profession that works towards the prevention of disability and restoration of independent functional ability. What do? They work with people of any age to promote health, prevent disability, and develop or maintain abilities. So if somebody has a condition or an illness, and they have a hard time doing day-to-day activities or doing some recreational activities, then we work with them to try to make them as independent and as functional as possible. OTs work in a variety of different settings. Some examples there are at the hospital, mental health clinics, the schools, community-based centers, nursing homes, home health, just to name a few. And depending on the setting, occupational therapy is going to look a little bit different, but we're all working under that philosophy of regaining function and making people as independent as possible. So a typical day at DHR Health Therapy Institute, normally I see about 6 to 8 patients. Again, these are patients who've had some sort of brain injury or some sort of recent surgery. And what we do with them is we do a variety of different activities. We'll do some exercises to try to regain some function. But because they might also have weakness, they might also have a hard time doing simple things like getting in and out of the house, getting in and out of the bed, or a car, or even dressing themselves. So we work on those type of things as well. Some of them enjoy doing recreational activities like, say, riding their bike or playing golf. And so we also use those activities in their therapy session to make it fun and to make it functional. There's a lot of education that goes on with the family and the patient. Sometimes they need special equipment, or they just need some education on things they can do at home. So there's a lot of training with the family and the patient. All the things that we do in the therapy are evidence-based, meaning we look at the research, we see what studies say are the most effective interventions, and that's what we do with the patients so that way we get the best results with them. Some specialty areas that OTs can focus on an outpatient clinic is they can get a specialty in, say, hand rehab, driving rehab, community mobility, vision rehab, and there's a few other ones, but those are the main ones on an outpatient basis. We also work alongside other healthcare professionals as a team, so we will work with speech pathologists, we'll work with physical therapists, and in some settings, nurses and other doctors. So what does the outlook look for as the OT profession? Well, according to the U.S. Bureau of Labor and Statistics, Employment of the occupational therapist is projected to grow 18% from 2018 to 2028, which is much faster than in average of all the occupations. So that's pretty much for all healthcare related jobs and professionals. They're always going to have a job in the workforce. How does one become an occupational therapist? It is a graduate program, so you'll have to get your bachelor's, typically something related like biology or rehab, and then you apply to a program which can be very competitive. At the moment, it's a master's program, but in the next few years, it's going to be transitioning to a doctorate program. So basically what that means is once you get your bachelor's and you apply to one of these programs, if you're accepted, upon completion, you'll get both a master's and a doctorate degree. Some things that I wish I knew when I was younger, before I started school, is how to pay for school and try to avoid student loans. I have a son that'll be a senior, so one of the things I tell him is get your resume ready. So that means getting good grades, being part of extracurricular activities, doing some sort of activities in the community. That's going to help with not only school applications, but applying to scholarships and grants. That's free money. All you have to do is search for them. There's apps that help you search for these scholarships and grants. You might just have to fill out an application and write a letter, but it's free money. So it's definitely worth the investment of time. You can also work and save. And if you start working and handling money, then you definitely need to get on a budget. And also do your research on the schools. See what the cost is on different schools. How much cheaper is it if you stay in Texas as opposed to going out of Texas? So all these things will help you if you start looking into a career in occupational therapy. So there's some exciting things happening with rehab in general. Over the last few years, there's been a boom in technology. You might have already seen some of this on TV, but there's a lot of technology that's being incorporated into rehabilitation. Everything from robotics to virtual reality systems and other different kind of mechanic and robotic and electrical equipment. And that's only going to keep on advancing and get more sophisticated. So if you enjoy trying to help people, if you enjoy learning about the human body and how it works and functions, if you enjoy learning about the brain and you enjoy technology, then definitely look into a career in not just occupational therapy, but some of the allied healthcare professions, where it's going to just be explosive with all these high-tech equipment in the future. Again, students, thank you for your attention. Stay safe.